Most people believe diabetes begins quietly in the background with common signs like constant thirst, frequent bathroom trips, or sudden tiredness. That idea is only a small part of the full picture. What many do not realize is that the body often starts sending warnings much earlier, and in a place most people never think about, the feet. Right at the lowest point of the body, where blood flow is slower and nerves are more vulnerable, early damage can begin to show itself long before a person even suspects a blood sugar problem. These early signals are often mild, easy to ignore, and slowly get worse over time. That is where the real danger lies, because by the time the stronger symptoms appear, the condition may already be developing for months or even years without attention. This video is built to uncover those early warning signs that often go unnoticed, especially in daily life when people assume discomfort is normal, temporary, or related to age or fatigue. There is a reason doctors pay close attention to foot health when it comes to blood sugar issues. High blood sugar does not just stay in the bloodstream. Over time, it starts affecting the smallest nerves and blood vessels in the body. The feet are one of the first areas where this damage becomes visible. Reduced circulation, nerve irritation, and slow healing processes begin to change the way the feet feel and function. What makes this even more concerning is that these changes often start without pain. The body does not always send a loud signal in the beginning. Instead, it sends quiet hints, a slight tingling sensation that comes and goes, a strange numbness that makes touch feel different, a burning feeling at night that is easy to dismiss. These are not random issues. They can be early signs that something deeper is happening inside the body's blood sugar control system. Throughout this video, each warning sign will be explained in a clear and simple way so that it is easy to understand what is normal and what could be a sign of concern. You will learn how small changes in the feet can connect to larger internal changes in blood sugar levels. You will also discover why wounds that take longer to heal, dry and cracked skin that does not improve with basic care, or repeated infections in the feet can sometimes point toward hidden metabolic stress in the body. Even changes in foot color or temperature can provide important clues about circulation problems that are often linked with early stages of diabetes. Each point in this video is designed to help you recognize patterns that are usually overlooked in everyday life. The goal is not to create fear, but awareness. Many people live for years without realizing that their body was trying to warn them in subtle ways. Feet are often ignored because they are out of sight and out of focus, but they carry some of the most important early information about overall health. When the nervous system starts reacting to high sugar levels, it often shows up here first. This makes understanding these signs extremely important, especially for anyone who wants to take control of their health before serious complications develop. As this video continues, the focus will be on 9 specific warning signs that can appear in the feet. Each one will be broken down in a way that makes it easy to identify in real-life situations. You will also learn why these changes happen inside the body, so the signs are not just memorized but actually understood. This deeper understanding is what helps separate normal discomfort from signals that should not be ignored. Some of these signs are so subtle that many people live with them for years without connecting them to blood sugar problems at all. That is why paying attention to the full explanation is important from beginning to end. By the end of this video, you will have a much clearer idea of how the body communicates early warning signals through the feet and why recognizing them early can make a major difference in preventing long-term complications. You will also be able to better understand when it is time to pay closer attention to changes in your body instead of brushing them off. This knowledge can help protect long-term health and encourage earlier action when needed. Stay with this video until the end because each sign builds on the next, and missing even one detail can mean missing an important clue your body may already be giving you. If you find this information helpful, make sure to subscribe to the channel. Here, we bring simple and clear health explanations that help you understand what your body is trying to communicate before small issues turn into bigger problems. Diabetes is a long term condition where the level of sugar in the blood stays higher than normal for a long period of time. When this happens again and again, the body slowly starts to struggle with the effects of that extra sugar moving through the bloodstream. Over time, this high sugar level begins to damage important parts of the body that are responsible for sending signals and keeping circulation smooth. The two most affected systems are the nerves and the blood vessels. Nerves are like communication lines in the body, and blood vessels are like transport routes that carry oxygen and nutrients to every part of the body. When both of these systems are affected, the body starts showing changes in different areas. And one of the earliest places where these changes become visible is the feet. This condition is often referred to medically as diabetes mellitus, and its early effects are not always obvious in the beginning stages, which is why many people do not notice the problem until it becomes more serious. The reason the feet show early signs is related to how the body is structured and how blood flow works. The feet are the farthest part of the body from the heart, which means blood has to travel a longer distance to reach them. When circulation is strong and healthy, this is not a problem. But when blood sugar remains high for a long time, it can slowly damage the small blood vessels, making it harder for blood to flow properly. At the same time, the nerves in the feet begin to lose their normal function due to constant exposure to high sugar levels. This combination creates a situation where changes start happening silently without strong pain or obvious symptoms in the early stages. Because of this distance from the heart and the weaker circulation in that area, the feet become one of the first places where warning signs begin to appear. This is why the feet can be described as a kind of early warning system for the body. They react to changes in blood flow and nerve health before many other parts of the body show clear symptoms. When circulation slows down, or when nerves start to lose their normal sensitivity, the signals appear in subtle ways that are easy to ignore in daily life. Small sensations that feel unusual, changes in skin texture, or differences in how the feet respond to touch or temperature can all be early indicators that something is changing inside the body's blood sugar balance. These early changes are not always painful, but they are important because they show that the internal systems are under stress. One of the earliest warning signs is a tingling sensation in the feet, often described as a feeling like pins and needles or small electric shocks moving through the skin. This happens when nerves become irritated due to high blood sugar levels affecting their normal function. The sensation may come and go at first, and many people ignore it because it feels mild or temporary. However, when it continues or becomes more frequent, it can indicate that nerve damage is slowly beginning. This is often one of the first noticeable signs that the nervous system in the feet is under stress. Another important sign is numbness in the feet. This means that the normal sense of touch becomes weaker or less accurate. A person may not feel pressure, temperature, or minor contact as clearly as before. This happens when nerve signals become slower or weaker due to prolonged exposure to high blood sugar levels. The danger of numbness is that it increases the risk of unnoticed injuries. Small cuts, pressure points from shoes, or minor wounds may go unnoticed because the normal warning sensation of pain is reduced. Over time, this can lead to complications if not addressed early. A burning sensation in the feet is another early sign that can appear, especially during rest or at night. This feeling is often uncomfortable and may feel like heat building up inside the feet without an external reason. It is linked to nerve irritation and changes in nerve function caused by ongoing blood sugar imbalance. The sensation can vary in intensity and may become more noticeable when the body is at rest because there are fewer distractions, making the discomfort more noticeable. Slow healing wounds on the feet are also a significant warning sign. Normally, small cuts or injuries heal within a short period of time. However, when blood sugar levels are high, the healing process becomes slower. This happens because high sugar levels reduce the efficiency of blood flow and affect the body's ability to repair damaged tissues. As a result, even small injuries can take longer to heal, and in some cases, they may worsen instead of improving. This change in healing speed is an important indicator that the body's internal repair system is under stress. Dry and cracked skin, especially around the heels, can also appear as an early sign. This happens due to a combination of poor circulation and reduced moisture balance in the skin. When blood flow is not optimal, the skin does not receive enough nutrients and hydration, which leads to dryness. Over time, this dryness can cause cracks, which may become painful or vulnerable to infection if not managed properly. This change is often gradual and may be mistaken for simple skin dryness, but when it continues despite regular care, it can be linked to underlying blood sugar issues. Frequent foot infections are another warning sign that should not be ignored. This includes fungal infections like athlete's foot or bacterial infections that appear more often than usual. High blood sugar creates an environment where harmful microbes can grow more easily, while also weakening the body's natural defense system. As a result, infections may become more common, take longer to heal, or return repeatedly even after treatment. This pattern can indicate that the body's immune response is being affected by long-term sugar imbalance. Swelling in the feet or ankles can also occur as a warning sign. This happens when fluid balance in the body is disrupted due to circulation issues. When blood does not flow properly through the lower parts of the body, fluid can begin to collect in the tissues, leading to visible swelling. This swelling may come and go or remain consistent depending on the severity of circulation problems. It is often more noticeable at the end of the day or after long periods of standing or sitting. A change in foot color is another important sign to observe. The skin of the feet may appear darker than usual, bluish in tone, or sometimes unusually pale. These color changes are linked to reduced or irregular blood flow. When blood circulation is not stable, the amount of oxygen reaching the skin changes, which affects the natural color of the feet. This is often a sign that blood vessels are not functioning at their normal capacity. Loss of hair on the feet or toes is another subtle but important sign. Hair growth depends on good blood supply to the skin and follicles. When circulation decreases due to blood vessel damage, hair growth in these areas may reduce or stop completely. This change happens slowly and is often overlooked because it is not painful or uncomfortable. However, it can be one of the physical signs that blood flow to the lower extremities is not as strong as it should be. There is a pattern that often repeats itself in real life when it comes to early health warnings in the body, especially in conditions related to blood sugar imbalance. Many of the earliest signals do not feel serious at first. They do not come with strong pain or immediate discomfort that forces attention. Instead, they appear slowly, in a way that feels normal or easy to dismiss. This is one of the main reasons why early warning signs in the feet are often ignored for long periods of time. People continue with their daily routine, assuming that the sensations they are feeling are temporary or connected to simple fatigue from walking, standing, or aging. In many cases, the body is already showing subtle changes that are pointing toward deeper internal stress, but these signals are mentally categorized as normal physical tiredness. This becomes more concerning when small symptoms continue for weeks or months without improvement. A slight tingling sensation is brushed off. A mild numb feeling is ignored. A small burning sensation at night is explained as overuse of the feet. Dry skin is seen as a weather-related issue. Swelling is linked to long-standing hours. Each symptom is treated separately and given a simple explanation that feels harmless. The real issue is that these signs are not isolated events. When they begin to appear together or repeatedly, they can form a pattern that reflects changes happening inside the body's blood sugar regulation system. The danger lies in how easily the mind adapts to discomfort and normalizes it, even when the body is sending signals that should not be ignored. There is also a strong psychological factor involved. When people do not experience sharp pain, they often assume that nothing serious is happening. Pain is usually seen as the main indicator of a problem. However, in conditions related to nerve changes, especially those linked to long term blood sugar imbalance, the early stages may not involve strong pain at all. Instead, there is a gradual loss of normal sensation or unusual new sensations that do not feel urgent. This creates a false sense of security where the person believes everything is fine because daily activities are still possible. Meanwhile, inside the body, small changes continue to develop in the nerves and blood vessels without interruption. Over time, this delay in recognizing early signals can allow internal damage to progress silently. The nervous system in the feet may continue to weaken, and circulation may become less efficient without obvious warning signs that feel serious enough to take immediate action. The most important issue here is not just the presence of symptoms, but the delay in understanding their meaning. By the time stronger pain or more noticeable problems begin to appear, the internal changes may already be at a more advanced stage than expected. This is why early attention to subtle changes is important, even when they seem small or unrelated at first. A key line that reflects this situation is that by the time pain becomes obvious, the nerve damage is often already advanced. This is because nerve related changes do not always start with pain. In many cases, they start with reduced sensitivity, unusual sensations, or minor discomfort that does not seem serious. Pain tends to appear later when the damage has progressed further, meaning the early phase has already passed without clear warning. This makes early awareness extremely important, especially when multiple small symptoms begin to appear together in the same area of the body, such as the feet. It is important to understand that these warning signs are not meant to be taken as a direct or final diagnosis of any condition. The presence of tingling, numbness, burning sensations, slow healing, dry skin, swelling, changes in color, or loss of hair on the feet does not automatically confirm diabetes. These signs alone cannot be used as a complete medical conclusion. However, they are still important indicators that something in the body may not be functioning at an optimal level. They act as signals that suggest further attention may be needed, especially when they occur repeatedly or in combination with each other. When multiple signs appear together, the level of importance increases. A single symptom might be related to temporary causes such as footwear, weather, or physical activity. But when several symptoms begin to show up at the same time or over a short period, it becomes more meaningful. For example, when numbness is present along with slow healing wounds and dry, cracked skin, the combination suggests that both nerve function and circulation may be affected. This is where understanding patterns becomes more important than focusing on individual symptoms alone. The underlying reason behind these changes is connected to how blood sugar imbalance affects the body over time. When blood sugar levels remain higher than normal for long periods, they begin to impact the health of small blood vessels and nerves. These systems are very sensitive to changes in internal chemistry. The nerves in the feet depend on steady blood flow and proper oxygen supply to function correctly. When this supply becomes inconsistent or reduced, nerve signals can become weaker or distorted. At the same time, circulation issues can slow down the delivery of nutrients and oxygen to the skin and tissues, which affects healing, sensitivity, and overall foot health. This is why the feet often become one of the earliest areas where changes can be noticed. They are far from the central circulation point, which means they are more affected when blood flow becomes less efficient. Even small disruptions in circulation or nerve function can become noticeable in this area before other parts of the body show clear signs. This does not mean that every change in the feet is related to blood sugar issues, but it does mean that consistent or unexplained changes should not be ignored, especially when they continue over time. As the situation develops further without attention, more serious complications can become possible. One of the major concerns related to long-term blood sugar imbalance is nerve damage, where the nerves lose their ability to send accurate signals. This can lead to loss of sensation, increased risk of unnoticed injuries, and long-term discomfort. Another concern is frequent infections, especially in the feet, where small wounds may not heal properly and can become more severe if not treated in time. In more advanced cases, when circulation and nerve damage become significant, the risk of serious complications increases. including conditions that affect mobility and overall foot health. In extreme situations, untreated long-term complications can lead to very severe outcomes, including the risk of tissue damage that may require medical intervention beyond basic treatment. This is why awareness at an early stage is considered important. The goal is not to create fear, but to encourage attention to small signals before they develop into larger problems. The body often gives early warnings in quiet ways, and understanding these signals can help in taking timely steps rather than reacting when the condition has already progressed significantly. As this video comes to an end, one important truth stays behind everything discussed. The feet are not just a part of the body used for movement or balance. They work like a quiet signal system that reflects what is happening inside the body long before most people realize something is wrong. When blood sugar starts affecting nerves and circulation, the earliest changes often appear here first. That is why small sensations, changes in skin, or unusual feelings in the feet should never be completely ignored, especially when they continue or appear together over time. The body rarely stays silent, it always communicates in subtle ways before showing stronger signs. Ignoring these early signals often means missing the chance to notice a problem at a stage where it is still manageable. Many people only pay attention when discomfort becomes strong or when daily life starts getting affected. But by that point, internal changes may have already progressed further than expected. The real importance lies in paying attention earlier, when the signs are still small and easy to overlook. Understanding what the body is trying to communicate can make a major difference in taking the right steps at the right time. If you found even one of these signs familiar or surprising, it is always better to take it seriously and consider getting your blood sugar checked for peace of mind. Awareness is not about fear, it is about prevention and understanding your body better before small signals turn into bigger concerns. If this video helped you understand something new, take a moment to like the video, share it with someone who might need this information, and subscribe to the channel. On this channel, more simple and clear health videos are coming that help you recognize early signs your body may be giving you so you can stay informed and take better care of your health every day.